My name is Laura Evans. I'm the Director of Public Policy with Vibrant Emotional Health. Vibrant, in addition to providing direct services in New York, is also the administrator of the 988 Lifeline. Greetings. So we are going to get started. Again, our featured presentation is from Angela Weeks, but before we get into that, just want to go through our usual segment of updates and where you can find information. And always make sure that you bookmark talk.crisisnow.com so that you know what is going on. This website is where you can sign up for the Learning Community newsletter. You can get materials. You can see who's is going to be the next speaker. We have all the various segments broken out so you can go directly to what you may be looking for. And again, it is the recent highlights, so the previous week, but also there's information going all the way back to the beginning. So please make sure you check out talk.crisisnow.com so you can catch up on anything you may have missed. Lots of good presentations every week. And so these are the top 5 episodes of the Crisis Jam. You'll see highlighted here where we've had both live participation via Zoom, but it's okay if you missed the Zoom, you can always check it out on YouTube. And again, you can access that through talk.crisisnow.com. It will have a YouTube link. And you'll see here we've gotten some really good jams, particularly around youth going live, tech. So again, every week it is something new, so try to join us if you can. Let's keep going to the next slide. Again, we have a lot of items packed in today, so I want to make sure that we get a chance to get to all of our speakers. I also want to highlight and make sure that you book your calendar for July 12th. That's going to be episode 135, and that is when 988 turns 1. So the official anniversary of 988 being universally available is July 16th, 2023. But for the Crisis Jam, we meet every Wednesday, so that will be July 12th. And our featured presentation will be from Monica Johnson, who heads up the SAMHSA 988 coordinating office. Very excited about that. So please mark your calendars and try to join us if you can. Next slide. Just some quick updates on the latest crisis news. You all may have seen this press release from SAMHSA. If not, we will be sure to drop links to the chat, and I'm sure SAMHSA will mention it briefly during their update. And it is an updated toolkit. You know, we have heard from partners, advocates, individuals across the spectrum who said they want new shareables. So there are new social media shareables about 988. Thank you for sharing in the chat as well. So these are shareables that you can use on your social media, on your organization's social media, to let folks know that you can text 988. Look at those motion graphics. Love it. So again, you matter. 988 is always here to help. I really like these. It allows people to go with the action, breathe in, hold, breathe out. Again, and if you all have ideas for social media shareables, I'm sure SAMHSA is open to that. Looks like folks are still looking for bumper stickers, so something for us, for SAMHSA to keep in mind as we move forward, and definitely hear you, Dean, about the need for additional Spanish language content. I do believe there are some, but we need to make sure that there's just as many options in Spanish as there are English and other languages as well. Let's keep going. All right, well, looks like we are now at our featured presentation. So with that, please let me introduce Angela Weeks. She's the project director for the Center of Excellence on LGBTQ+ Behavioral Health Equity, which is at Innovations Institute at the University of Connecticut. So with that, Angela, I'll turn it over to you.
Thank you so much. And I am so grateful to be with you all today, to be talking about this population. and want to make myself a resource for everyone on this call and your colleagues to reach out to after this session. If you all have questions, want to be connected to resources, I'll move pretty swiftly because we do have a lot to cover. So next slide, please. I think one of the reasons I'm so happy that we're talking about LGBTQ populations specifically is because crisis among this population and suicidal ideation, thoughts, attempts, the data is really high for LGBTQ populations. And I'll talk a little bit about why. But one of the things that I would love everyone to know is that LGBTQ people experience unique vulnerabilities directly related to hostility, violence, and rejecting behaviors. So as we talk about data today, just keeping in mind that the disparities that this population experiences, it's not because of their LGBTQ identity, it's because of the discrimination and the stigma and the violence that they're experiencing daily. Next slide, please. Some of the risk factors that folks should familiarize themselves with is this population facing a lack of family acceptance or support. This could look like being ostracized from their family, being rejected from their family, isolated from family events, or even suffering harassment, bullying, or abuse from their family as it relates to their sexual orientation or gender identity. They could also be ostracized from community in general if they're living in communities that are not affirming or supportive of the population. There's also really high rates of bullying, harassment, and violence across the population for each type of identity, sexual orientation or gender identity. They have their own set of statistics around how often they experience this. But to give you an idea, the majority of high school students, around 90%, still report hearing anti-LGBTQ stuff at school regularly. So this is pretty pervasive still. There's also a lack of visible possibility models. So, that's really important to see other successful, happy LGBTQ people that look like you out in media, out in your community, and there's just a lack of visible role models in that way. There's a lack of social programs in many areas. There's not programming dedicated to LGBTQ identities, which is really important because of these unique circumstances the population faces. And there's even less specific programming for their families, which we know is a really big need. There's limited access to gender affirming care or LGBTQ affirming care. And even now, if anyone's been following the news, we can see that there's a lot of anti-LGBTQ legislation that's impacting this population and blocking access to gender affirming care, which is taking a toll on mental health. Then there's stigma associated with these identities that is constantly being navigated. There's a possibility of internalized biases and also economic hardships due to discrimination. So all of these things lead to higher rates of isolation, depression, anxiety, minority stress, and other mental health outcomes. Next slide, please. So a few specific statistics I want to point out. One study found that 44% of Black LGBTQ youth seriously considered suicide in the past 12 months preceding the survey, including 59% of Black transgender and non-binary youth. So these are really large numbers. Next slide. People who identify as bisexual are 4 times more likely to report an attempted suicide when compared to people who identify as straight, lesbian, or gay. And then people who identified as lesbian or gay were 2 times more likely to report attempted suicide compared to those who identified as straight. Next slide. In a national study, 40% of transgender adults reported having made a suicide attempt. 92% of the individuals reported having made the attempt before the age of 25. Next slide. The Adolescence and Behaviors and Experience Survey found that 26.3% of lesbian, gay, and bisexual high school students had attempted suicide in 2021, compared to 5.2% of youth that identified as straight. And I just have one more stat. In that same survey of those who identified as transgender, 35% of them had attempted suicide compared to 15% of young people who did not identify as transgender. So as you can see from those data points, this is pervasive for this population, and it's because of all of that rejection and stigma and bias that they're navigating. And I also want to just hold a moment to talk about LGBTQ older adults as well, that are often not spoken about in presentations or left out of the conversation. When you are talking to an LGBTQ older adult, there may be instances where their historical trauma is coming into the conversation. Many LGBTQ older adults did live through a time where being LGBTQ was criminalized. And even now for trans populations, it's still criminalized in many ways. And so acknowledging that trauma can be important. They also lived through a time where it was very hard to build a family. They were blocked from accessing family building mechanisms like fostering and adopting, which is still something that is debated in some states and localities. They also survived through the AIDS epidemic, where they lost many community members, many family members, people that they loved, and where the government was taking no action to help support or improve that situation. And then for up until very recently, many people were not allowed to get married. Many were also ostracized from their families when they came out. And I'll just say too that there's an economic impact that was for those that were unable to get married or access survivor benefits of their spouses once their spouse passed away. They often suffered just having limited income because that resource wasn't available to them until very recently. And so these are all just things. There's more here to unpack, a lot more to talk about, but I just wanted to hold a moment to talk about that historical trauma. Next slide. So I'll talk a little bit about protective factors. Next slide. These are things that all deserve their own session or their own digging into, but basically the things that help protect for this population are easy access to effective affirming care. People who have higher self-esteem that's also a protective factor. Learning and applying coping skills, supportive family, that could be family of choice, it could be teachers, it could be mentors, connection to other LGBTQ people, positive role models or being a role model to other, hope of transitioning to affirms one's gender identity, supportive communities, which also includes churches, schools, places of employment, and positive reactions to coming out. Next slide. I also want to note, this is one of my favorite data points. A report from the Trevor Project shows that just one accepting adult can reduce the risk of suicide attempt by 40%. So that support and affirmation really matters. Next slide. One thing that is just helpful to highlight is that as you are working with folks through crisis, you might also get the opportunity to work with families that are struggling with their own fear or guilt or anger or confusion around this topic. They may not understand their young person, what that identity means. They may not understand the behaviors of their young person, or dealing with some of the fallout from their own rejecting behaviors. So it's also worthwhile to look into some resources around families to help just build your understanding about what that process is. Next slide. So I'm just going to list off some very important resources here. One, we have an animation that talks about family support. It's 10 minutes. It's amazing. Please check it out. It goes over the important stats, and this is something that can be shared with families. Next slide. The Family Acceptance Project has also done tremendous work around creating resources for families. They have them available in many, many languages, and the link to their website is also going in the chat. Next slide. Included in their resources is family education booklets that really help families learn how to replace rejecting behaviors with more supportive and positive ones. And these are also available in many languages. Next slide. We have an animation that describes what sexual orientation and gender identity is and really explains different components of people's identities. This is a tremendous resource. We love it. It's in English, Spanish, and Portuguese. We also just published it in French, and Arabic is soon on the way. So that's 6 minutes, and please share it with your colleagues and your community. We also worked with the Family Acceptance Project to develop a website just for families. That link is also being added to the chat. On this website, families can find resources near them. They can find specific faith-based resources and also culturally specific resources. Next slide. On our Center of Excellence webpage, you can visit that to get a host of free self-paced e-learnings. And we have 3 that will be published very soon that are specific to those working in 988 services. And so there will be free self-paced training on the site that can help you dig into all of these topics and more. Next slide. And then just lastly, we have a national SOGI center, which is basically a clearinghouse of resources from across systems of care. And there's loads of resources for young people, families, the workforce, anything that you can think of. We've tried to include on this website. So be sure to check that out too. And again, just please feel free to use me as a resource to help navigate any of these things that we're sharing. So I would actually like to pass the microphone over to Tina Jones, who is going to share a little bit about her own lived experience. So Tina, can you take it away? And you're on, there you go.
I'm off mute now. Yeah, so thank you so much. And I'm Tina Jones. My pronouns are she and her. I'm a 60-year-old trans woman. I want to speak to you today about my experience, but also want to speak to you about the experience of the teenager who we took into our lives about 3 or 4 years ago. I came out late. I didn't come out as trans until I was 56 for the fear, as Angela had talked about, of what would happen. And a lot of those statistics I've experienced personally. When I came out in 2019, I lost my job. As I was a college administrator, I lost my job. I lost many of my family members. My wife fortunately stayed with me. My 2 children have stayed with me. My mother is reconciling with it, but really I've lost pretty much everybody else in my family. So my brothers, my nieces, my nephews, all those other extended relatives. I got uninvited from family events. Family events were a big thing in growing up for me. And as an adult, I haven't been to any kind of a holiday celebration since 2019. And it's tough and it's traumatizing. I've had death threats. I had a death threat from a brother-in-law who, again, imagine this, around bathrooms, that told me if I went to the ladies' room when their daughter was there, that they would seriously harm or kill me. So when Angela talks about the trauma, we all come with that kind of trauma. But I feel very privileged because, again, I grew up being perceived as white and cisgender and male, with a college degree and a professional career. So I was able to acquire resources that many people don't have. I also had access to healthcare for gender affirming services, which a lot of folks don't have. But again, there was a lack of services where I live. I live in a rural community on the eastern part of Maryland. And when I came out, there was no pride centers. There were no transgender support groups. I actually am the founder of both of those locally. There was one place to get any kind of hormone replacement therapy. There were no surgical options. There was no mental health practices out there that actually were what I would call knowledgeable on the issues. So that was so important. But what I want to leave you with is this. We took in a 16-year-old child 3 years ago who came out as non-binary, was kicked out of their house by their father, sent to their mother's house when they were kicked out of that house, had all of the trauma associated with it that Angela spoke to. We took this child in off the street, became foster parents for them, but so much pain and so much trauma had passed over through this child that last May, May 21st, they took their life in our home. And you know, it was the most devastating thing I've ever been through. This child had been in our lives for 2 years, and they were incredibly smart. They were a writer, they were an artist. They when given the chance, they excelled at school. When they got a chance to actually be loved, we saw their grades change from having less than a C average to having almost a straight A average in the 2 years they were with us. And yet that wasn't enough for this child to overcome the pain that they had had and the beliefs that had been instilled in them that they were not worthy of living. They left 2 suicide notes. They left one for their birth parents, which was very, very hard to read. And they left one for my wife and I, where the child, first of all, apologized that we had agreed to take her in because she knew she had made our life difficult. And second of all, she said she wished she had been born to us because she knew she would have had a different outcome. This is why it matters, folks. You know, we've got to have supports in place. We have to have systems in place. We have to have not just for children and for adults of all ages, but for the families as well, so that we don't have to bury another child.
Thank you, Tina, for sharing your story. And thank you, Angela, for that presentation. I am just so moved by it. And I was really struck by what you mentioned, Angela, and what you just reiterated, Tina, is it takes one person to show love. And perhaps that individual would still be with us today, but there's hope. And I want to bring in our roundtable so that we can talk about just reactions and supports that the LGBTQ community may need. So first, I'm going to introduce Dennis Barrett, who is the Federal Affairs Manager with the Trevor Project, and then as well bring in Cheryl Whalen, who's the Senior Director of Special Initiatives and Partnerships with SAGE, Advocacy and Services for LGBTQ Elders, which is a population that we often sometimes don't get a part of that conversation. So let me turn it over to you first, Dennis. What are your reactions?
Thank you, Laura, and both thank you to Angela and thank you, Tina, for sharing again your stories. You know, these are stories that unfortunately we hear all too often here at the Trevor Project. But I'm really excited to be in virtual community with you all and to be a part of this conversation today. We'll move to the next slide. So as Laura said, my name is Dennis Barrett. I use he, him pronouns, and I am the Federal Affairs Manager at the Trevor Project. Next slide. The Trevor Project is the leading suicide prevention and crisis intervention organization for LGBTQ young people. Our mission is to end the public health crisis of suicide among LGBTQ youth. Next slide, please. We operate 24/7 free and confidential crisis services for young people who need support via phone, text, and chat, as well as innovative research, advocacy, education, and peer support programs. Next slide, please. Suicide is the second largest cause of death among young people, and LGBTQ young people are more than 4 times as likely to attempt suicide than their peers. The Trevor Project estimates that more than 1.8 million LGBTQ youth between the ages of 13 and 24 seriously consider suicide each year in the US, and at least 1 attempt suicide every 45 seconds. Next slide, please. And while these findings are alarming, as Angela said, whenever we discuss these suicide risks among LGBTQ young people, it's always important to clarify that LGBTQ young people are not inherently prone to suicide risk because of their identity, but rather they are placed at higher risk because of how they are mistreated and stigmatized in our society. Next slide, please. Our crisis counselors are trained to answer calls, chats, or texts from LGBTQ young people who reach out to our free and secure services when they are struggling with issues such as coming out or inviting in, LGBTQ identity, depression, and suicidal thoughts. Our philosophy is that no crisis is too small or too large. From August of 2021 to July of 2022, the Trevor Project served more than 260,000 young people. They reach out to the Trevor Project to discuss a number of topics, such as to support them because they do not feel accepted for who they are by those around them. They may share that their families are unsupportive or that they are experiencing bullying at school because of their identity. And sometimes our young people are reaching out to talk about the process of coming out or inviting in, or determining if and how they want to share their LGBTQ identity with others. Sometimes these young people reach out to our counselors because they need someone supportive just to talk to. Next slide, please. Young people are also reaching out to us to talk about the impact of our current events have on them. And sometimes that is to share that they are feeling overwhelmed by the bad news, including anti-LGBTQ politics and rhetoric. Next slide, please. COVID-19 has had a lasting impact on all of us, and 56% of LGBTQ young people reported that their mental health was poor most of the time or always due to the COVID-19 pandemic, including more than 3 in 5 transgender and non-binary youth and nearly half of cisgender youth. Across our 24/7 crisis services, we heard from young people who lost access to vital support systems and care, those who were confined to unsupportive home environments, and those who lost loved ones. The impacts of this pandemic and the trauma it has caused will take us a very long time to realize and a very long time to support our young people through. Next slide, please. In this year, we have witnessed a record wave of anti-LGBTQ legislation with, from our calculations, more than 600 bills across the US, most of which are specifically targeting our transgender and non-binary young people. The Trevor Project's polling has found that 85% of trans youth say that debates around anti-trans laws have negatively impacted their mental health. And our 2022 national survey found that 93% of youth are worried about 93% of trans youth are worried about trans people being denied access to gender-affirming medical care due to state or local laws. Next slide. We know that being an ally is absolutely critical to building resilience and supporting mental health for LGBTQ youth. Next slide. And it's not only important to surround LGBTQ with supportive peers and adults, but it is also critical that young folks have access to culturally responsive LGBTQ supportive services that they need. And that is one of the ways that we do that is through 988. And while LGBTQ young people face a number of unique challenges, especially right now, we can all do our part to support them. Supporting LGBTQ young people does not require us to be experts on LGBTQ topics. It just requires us to lead with empathy, kindness, and to listen. Next slide. Thank you all so much for having me with you all here today. And if you have any questions or would like to follow up, I will be dropping my email in the chat. And again, thank you so much.
Thanks, Dennis. I'd like to bring Cheryl in.
Thank you so much. And I'm going to try to wrap up this part of the presentation pretty quick. You know, I just want to say that SAGE, we are the largest and oldest organization dedicated to providing advocacy and services for LGBTQ+ elders. And as we reflect on what's already been shared today by Angela, Dennis, and most importantly, Tina, you know, these experiences that we hear about for LGBTQ+ older adults is oftentimes a lifetime of stigma, discrimination, violence, abuse, neglect that leads our LGBTQ+ elders to continue to experience this trauma that can really impact, you know, how we relate to our communities, how we navigate our way through daily life. And so it's really important that, you know, as we think about 988 lines and crisis centers, that we also think about these lived experiences of our LGBTQ+ elders. We've ran the SAGE National LGBTQ+ Elder Hotline since 2019. And over that time, we've seen nearly 8,000 calls that have come into our center. And most of these calls are specifically related to crisis and emotional, you know, concerns, suicidology, and just, you know, wanting to seek supportive services in the community. So as we think about everything that we've shared here today, please continue to think about the LGBTQ plus older adult and how, life really compounds over time when we have experienced this type of stigma and discrimination across our lifetimes. So I just want to kind of wrap up the conversation for the roundtable. I'll drop some more resources in the chat and allow us to move on to the next segment for the Crisis Jam today. Thank you.
Thank you, Cheryl, for wrapping us up. And thank you, Dennis, for your thoughts as well. And of course, Angela for our featured presentation, and Tina for sharing your story. And again, just thank you all for the information that you have shared. Before we move on, I also just want to highlight that there is an option for individuals who identify as LGBTQ youth to reach out to the 988 Lifeline. You can press 3, and that has recently expanded to availability 24/7, as well as via chat and text. So very pleased to have that available. And of course, more supports to come. I also want to note that there will be a Mental Health America webinar discussion for when equity meets policy, attacks, impacts, and pushback to the question that we saw in the chat around state legislatures putting forward anti-LGBTQ and other community, anti-marginalized community legislation. So that registration link is in the chat as well. Hopefully you can join for that discussion. I'm going to keep us moving and turn it over now to our hot seat. Oh, I'm sorry. We're going to talk a little bit about what's in the SAMHSA store. So, of course, there are 6 Spanish options. If you would like stickers, safety plan pads, wallet cards, magnet, posters, products, these are all available for free. So you can order up to 326 items for free. And the link is on the page, and I'm sure we'll drop it into the chat. There's also printable materials that you can use on your own and other framework items if you want to add your own organization logos or use information. So make sure you use that free resource from SAMHSA. And of course, the best way to talk about 988 is to wear it. I have a 988 shirt and I often wear it, and folks ask me, oh, what is that? And I use that as an opportunity to tell them more about the work of the 988 Suicide and Crisis Lifeline. So you have long sleeve options, short sleeve options, hats, multiple colors, different quotes from various Crisis Jam, either previous presentations or other figures in the crisis services space. So you can buy these, of course. There is a link in the chat for where you can purchase these, but you can also get one for free for volunteering to be in the Crisis Jam hot seat. So no matter if you get the question right, you will win because you get to choose your very own swag. So with that, we have our next crisis seat participant, and that's Jenna Schofield, who is the Senior Technical Assistance and Communications Associate with NASHBID, the National Association for State Mental Health Program Directors. Jenna, are you with us today?
Yes. Hi, Laura.
Hi, good to see you. So this question, I won't make you reveal your age, but it is a question in reference to John Lennon. And on the evening of December 8th, 1980, he was tragically shot and wounded in the archway of the Dakota, which is an apartment on the perimeter of Central Park in New York City. So the question is, how was he transported to the hospital? And so our options are ambulance, standby vehicles, coroners, police car. Whether or not you were alive at that time, this was a part of a featured presentation previously in the Jam. So what are you thinking, Jenna? Talk us through.
Oh boy. I don't know. Let me see. I was not alive in 1980. So I'm going to rely very heavily on the audience, I think, for this one. And I'm embarrassed that I'm not remembering this because I have been on almost every single Jam, I'm proud to say. But I definitely want to see what the poll has to say.
Okay, let's see.
Megan's giving me a tip. I do not think they had a strong 911 system yet. Thank you. Helpful.
And you do get to phone a friend. So if you want to call Megan up or someone else from the audience, The audience looks to be pretty split between a bystander vehicle and a police car.
My gut is telling me bystander vehicle. I think I'm going to go with B.
Okay, and let's see the correct answer.
Oh no.
Police car. Don't worry, this split us in the green room as well. This was a tough one, but as Megan highlighted in the chat, the first 911 call was answered in 1968, but it took nearly 30 years to build out an emergency medical response system, including ambulance capacity and accessible hospital emergency rooms that supported most Americans. So unfortunately, he was transported in a police car. But since that time, we have built out our system. And no matter what, you get a shirt or hat, Jenna. So thank you so much for being a part of the Crisis Jam. This one was hot. We'll have to let David know that they're getting too difficult.
Thank you for having me.
No worries. So at this point, I'm going to turn it over to Richard McKeon, who is the public health advisor for SAMHSA. Richard.
Thank you, Laura. I just want to echo something that Laura said, which is the incredibly important presentations and personal testimony that we've heard today. I think just underscores the importance of the press 3 option being added to 988 to provide rapid access to care for LGBTQ youth. So I think that's can't be said often enough. There are 2 other things that I'd like to cover. You can move to the next slide, I think. And so I want to invite the amazing Stacy Pulaski, who is on the call with us today, I believe, and is one of our incredible team of communications experts to talk about these new resources from 988.
Hey everyone. So Laura, you started us off great today sharing the resources. So I feel like this slide is only like partially good because she did a much better job having you guys see the breathe in, breathe out videos. But we do have the Mental Health Awareness Month shareables out. They went out yesterday or a couple days ago. And we definitely want everyone to use them for Mental Health Awareness Month. What you're seeing from us is that we are working to get you the shareables as early as possible, like working on getting things about a month ahead of any kind of particular month. So, and we saw the questions about Spanish. We are working on translating everything into Spanish. So those will be coming. Though you'll see the yard signs are in printable form. So that's the only piece. We had a lot of requests for yard signs. Those are available for you to download and print at your local printers. Those ones, we don't yet know if we're going to be able to have you guys be able to order them just because of the cost of them. So we're talking with the lawyers and such, just so you guys are, just for transparency's sake. In terms of other languages, I see that question. We're only doing English and Spanish. So if you want other languages, you're going to have to work on the translations from there. The other thing with materials, I know that it's come up on several recent crisis jams about people who have put in orders for materials. So I just want to address that with all of you. The warehouse at SAMHSA did shift over to the government publishing office, and they are working through a backlog of orders. We do have an email address, newmedia@samhsa.hhs.gov, and I'll put that in the chat after I finish talking. This is only for if you have put in existing orders. It is not for putting in new orders. if you have existing orders and you're trying to figure out and track those, then go ahead and send an email with your order numbers. And they can tell you the status of those, but they need the order numbers. Okay, and that email address again is newmedia, NEWMEDIA @samhsa.hhs.gov. And hope you all like the new materials.
Thank you so much, Stacy. Can we move to the next slide? So the other thing I wanted to bring to folks' attention is that the FCC has posted in the Federal Register a new proposed rule. And some of you may recall from the process of starting 988 for phones and for text, that this is part of how the FCC proceeds. They propose a new rule, they invite public comment, and then they respond to that. This one is to ensure the reliability and resiliency of the 988 Suicide and Crisis Lifeline. And these are rules concerning disruptions to communications. And obviously this is under the rubric of implementation of the National Suicide Hotline Improvement Act. So some of you will recall that unfortunately there was an outage that took place a couple of months ago. And when an outage occurs that can impact 911, there are specific rules around notification around that to help assist to the situation being remediated as quickly as possible. Those rules do not automatically apply to 988, but this rule is being proposed by the FCC as a way to resolve that. So there it will be, this is an opportunity for everyone to weigh in on that. Any organization, any member of the public can weigh in on FCC proposed rules. So we wanted to bring that to your attention so that you are aware of it and that you can provide input if you wish. We think this is potentially an important step forward. So Laura, that's what I have. Thank you.
Thank you, Richard. Thank you, Stacy. Always really great information. And thank you for what you all are doing and leading within SAMHSA and helping us get to this point. So with that, I'm going to turn it over to Megan Hopp with NASHBID.
Thank you so much, Laura. I just want to start by saying this is one of the most powerful crisis jams I've been part of. I'm just really deeply moved by the presentations, and I'm so grateful for Tina, you sharing your story, and Dennis being on, and Cheryl. It just, thank you. Thank you so much. That said, my emotion is like, just very emotional. But I do want to talk about something that states have been addressing and on all levels, and that is workforce. NASHBID is developing a behavioral health workforce guide that we had one iteration of it, and it was categorized by issue, but we realized that we really need to take a collaborative approach, a framework. So with permission, we have used a framework from the National Conference on State Legislatures. And this framework addresses understanding needs of workforce, increasing the supply, expanding the reach, addressing distribution, and retaining professionals. And the beauty of it is, by working with a framework, we're talking about workforce and establishing common language. And there are many other organizations also taking and collaborating around workforce. The National Council, for example, is working with multiple organizations to decide what aspects each organization could address to move the workforce issue forward. So whereas historically, workforce has been approached from kind of a piecemeal type of thing, or only looking at the way the system has been, this approach really looks at where is the system going? What are the needs of the workforce as the system changes and crisis services are established and we build out the crisis services system. In addition, wanted to also emphasize a wonderful workforce strategy, and that is supported employment and tailoring supported employment programs to provide individuals with certifications that enable them to work in the behavioral health field if they desire that. So I think there's a lot of opportunity for creativity right now. As hard as this workforce issue is, I think if we all work together, I think we can really move this needle. Thank you, Laura.
Thank you, Megan. And I think you're right. We just have to be creative. And I think the mental health community knows about being creative because we've often had to do so much with so little. So I just know we will find that solution, or at least share some good ideas here in this learning community. I'm going to turn it over at this point to Jessie Davis for our Lives Lens perspective. And Jessie is the president of the National Association of Peer Supporters. Jessie?
Thank you so much. Hi, everyone. I'm Jessie Davis. My pronouns are she and they, and I use both sets of pronouns. They both work great. I am currently president of the National Association of Peer Supporters. And if you haven't heard of us yet, we are an organization by peer supporters for peer supporters across the country. We have a lot of different things that we do to support the peer workforce, including continuing education. We do a conference almost every year, and we also focus a lot on federal advocacy on behalf of the peer support workforce. We are an organization for all peer supporters as well. I know in the past there had been a misconception that we were only for mental health peer support, or we only supported the mental health peer support workforce, but we're here for mental health, substance use, youth, crisis, formerly incarcerated, family peer support, domestic violence, focused peer support. We are here for the peer supporters of our workforce. Sorry if I spoke a little fast, interpreter. We also have, like I mentioned, have a conference every year, and I want to make sure to mention it because it will be in Norfolk, Virginia this year, and it is in October, and our conference theme this year is pathways, not just pathways to recovery, but pathways that peer support specialists can take in our careers, which includes working in the crisis sector, like you all are talking about here on the 988 crisis line, or crisis jam, sorry. And so I'm really excited about this, and I really hope that we will be able to get some of you all to submit presentations on what this can look like in organizations like yours. I also work for the South-Southwest Mental Health Technology Transfer Center, which is funded by SAMHSA to provide support in Texas, Arkansas, Louisiana, Oklahoma, New Mexico, and the indigenous communities within those borders, and we support the mental health workforce there. One of the products that we created in partnership with Peer Pride is a guideline document for hotline peer specialist integration. If you're looking to implement peer supporters or already have implemented peer supporters in your crisis line or crisis services, I would highly encourage you to take a look at this document because there's some really useful information there. I am so excited that you all are here, and I'm so excited that I am here. And so I'm going to make sure to put a link in the chat where you can get, you can just click on links to access the things that I've mentioned.
Great. Thank you so much, Jessie, for sharing your perspective. And again, one of the themes I'm hearing, right, is just being so inclusive and making sure that we are reaching people no matter what type of peer supporter they are or what supports they may need. So let's keep going. I'm going to turn it over now, and we're going to move to our data corner to Preston Looper. So Preston Looper is the principal at Full Tilt Strategies, and he's a self-proclaimed mobile crisis geek. I hope I got that right, Preston, as your intro. I'll turn it over to you now.
Perfect. Thank you. Today we have an opportunity, myself and Dr. Goldman, to give a first look at some results from the National Mobile Crisis Survey. So many of y'all are aware, and we got a lot of support from folks here. Myself and Dr. Goldman developed and administered and completed the most comprehensive national survey of mobile crisis that we're aware of to date. Our aims were to increase understanding of the organization, operation, and financing of mobile crisis teams. The survey was conducted in early 2022 in partnership with Vibrant, SAMHSA, NASHBID, and many others. And a total of 562 responses were used in the analysis. And so you can see from the map here, we organized the results based on SAMHSA region. So gave us an opportunity to compare apples to apples, and you can see across there fairly representative across the board, but a pretty, the largest percentage from the upper Midwest. And next slide, please. Our first publication from this effort, I'm very proud to say, was in Psych Services. And we focused on a core question related to the interface of mobile crisis and call centers, and asked the question, what number do you call to deploy? And we were intentional about not using the term dispatch because that varies very widely. What number can you call to deploy a mobile crisis team? And what you see here is that at the top, the vast majority are internal self-dispatch, where the mobile crisis will receive a request for services, make their own decision about that being an appropriate request, and then deploy the mobile crisis team in that way. However, if you look at the rollout of 988, and we administered this right very much at the same time, a little bit before that was going on. At that point, we identified a key opportunity. And at that point in time, only 1/3, you see here, 32% of mobile crisis teams were able to be deployed by National Suicide Prevention Lifeline, which is now the 988 crisis hotline network. And then you can see the others. Okay, next slide, and I think Matt will take this.
Yes, thank you so much, Preston, for walking us through these preliminary results. Just really want to emphasize, our goal was to understand the landscape of what's mobile crisis out across the US. And this key issue of 988 having a clear connection to local mobile crisis, there's 988 everywhere. So it's really a question of is mobile crisis, as sort of a core component of the crisis continuum, as plugged in to 988 as we want it to be. And so I think this highlighted that there's work to be done. There's a lot of work to be done here to really make sure that this kind of integration across the continuum is meeting the vision of many of the folks on this call. So with that, I'll hand it back to Laura. Thanks so much.
Thank you, Preston and Matthew. At this time, typically we have Stephanie Hepburn, who's our editor-in-chief for Crisis Talk, but I'm going to bring in Dr. Chuck Browning, the Chief Medical Officer for RI International, to see if he can talk a little bit about this article and his experience firsthand seeing this. Chuck? You're muted. I'm sorry.
Sorry. Hey, Laura. Thank you so much for letting me be able to talk about this. This story was near and dear to my heart that Stephanie worked on back in 2019 originally, because Veronica is a friend and a colleague of mine in my organization. And the general gist of the story was to talk about, even though she was an award-winning peer support and peer recovery coach in an organization and leading an amazing life of recovery, her fear of sharing her identifying the fact that she was receiving medication for opiate use disorder. And so this article really highlighted that challenge and that stigma, as well as some of the things that are going on across the country and the importance of being able to help support opiate use disorder with multiple different pathways, including best practice and evidence-based ways as well, and some of the challenges with that. So as I look back at this story, what's really cool of it being in 2019 is that there's definitely some things that are still the same, and yet some things that have changed for the positive. So some of the things are the same, is just, you know, being aware that this is not this stigma about using medication for opiate use disorder is not just universal to peer support. That I see it in running across all disciplines of our staffing, and it takes a lot of education and champions to help work against that and help support creating best practice for those that we serve and the atmosphere of how we engage with that. But some of the change I've seen is not just in our organization, but around the country. And we need to keep it in mind as we're designing our crisis systems, is incorporating medication for opiate use disorder in all levels of our crisis continuum, harm reduction principles. I'm seeing mobile teams that are out passing out naloxone now out in the communities as part of their role, and being able to help do that, having built into our call centers the ability to screen and give resources and know what the local resources are for treatment for that. And crisis centers being able to do inductions and start people in treatment or continue their treatment if they're on medication but are there for another reason that they're presenting in crisis. And the good news is Veronica is still doing fantastic and is continuing to move on in her career pathway, and does share that sometime. And one of the other things that's changed is many more peers in our organization identify as being in treatment and do what they do best, which is sharing their story to help engage people that we're serving, as well as being a voice and a leading example to the rest of our staff, which is something that peers are just so amazing at doing. So I think it's a story of something to be aware of, and we need to keep taking that fight of working against that stigma, but also some happiness to see change over the past several years in at least the things that I see.
Yes, well, thank you, Dr. Chuck. I think, you know, you hit the nail on the head there. You know, there's still stigma and we still have work to do with stigma. But again, people should feel free to share their stories. That's how we help erase the stigma. And so I'm glad to hear that Veronica is still doing well. And I do think you're right. We are seeing less stigma around medication use to help address substance use disorder. So really appreciate you bringing this one back from the vault and joining us today. I am going to keep us going and turning it over to Joanna Rosen from AFSP to share a federal update.
Hi, everyone. Thanks, Laura. So we don't have many updates for today. Congress is in recess at the moment, but two things that we can note are, first, the 988 Lifeline Cybersecurity Responsibility Act was reported out favorably from the Energy and Commerce Committee in the House last week. So this bill would help strengthen the lifeline against cybersecurity threats in the future. And then second, SAMHSA released their draft strategic plan, which covers 988 and crisis services, and they are soliciting public comments through April 27th. So I'm going to drop the link in the chat for both the draft and the comment submission form for anyone who's interested. That's all I have for today. Congress is going to be in recess again next week, but we will keep everyone updated as we're able with new information as it comes available. Thanks, Laura.
Thank you, Joanna. Really appreciate you all keeping track of that. At this point, I'm going to turn it over to Caitlin Davidson with Vibrant and Stephanie Pasternak with NAMI to give us an update on what's going on in the states.
Ooh. Sorry about the delay there, Laura. Similarly, not a lot happening, but I just wanted to share some good news from Maryland. There is a pair of bills that have moved to the governor's desk for signature, and that would put another $12 million towards 988 and related services for the coming year. And hopefully we'll have more next week. It was a little bit of a quiet week on the state legislation front.
Well, thank you, Steph. We appreciate that. You know, always helpful that someone's keeping an eye, even if there's not much going on. Want to talk a little bit about Moving America's Soul on suicide. We've talked about this for a number of crisis jams as well. Official trailer and segments available on YouTube. So we have outlined here the 6 videos that are currently available and hope to have additional videos available soon. But again, you can check those out on YouTube or talk.crisisnow.com. Next slide, please. I'm sorry, 8 are currently available. Number 9 will be released later this month. And then just want to also make sure that you keep a hold for next week. The next week's Crisis Jam will feature a fountain house and information about the Clubhouse model. And so I want to thank you all for joining us. We are right at 1 o'clock. So I think this is the first time we've landed exactly on time. Thank you for joining us. I hope you've learned so much today and look forward to seeing you next week.